Hi everyone, this is Shri Vidya. I welcome you all to my channel on Cardiac Essentials. Today we'll be talking about, diabetes. So that's like 98% of population are suffering with this sugar disease, nowadays. So, and also heart disease. Now we'll be talking about what is the relation between diabetes and this heart disease. They say like diabetes increases. What happens is diabetes, if there is an increase in the diabetic value, there is a risk of having a heart disease or stroke. So why is this so? Because of the high blood sugar levels. So when the blood sugar levels are high, they can damage the blood vessels and nerves. So people who are diabetic are also most likely they can also develop risk factors like high blood pressure, high cholesterol, obesity, and then which can lead to heart failure or heart stroke. So now you might be wondering, Dr. Shri, how do we protect this heart health? How do we manage these blood sugar levels? How do we control the blood pressure or cholesterol? Come up with a healthy lifestyle. Some time ago I was feeling like kind of exhausted. I myself was feeling like morning I would get up and I was feeling so exhausted and I won't be able to do anything. So I was just wondering what's going wrong. Then I realized that it's diabetes. And lately, like it's just been 2 years, I'm gone diabetic actually. So then I realized that it's diabetes that's causing all this. Then I went on for, regular walks and did some small lifestyle modifications. And you won't believe my diabetes came up to 99. It's a really good value, I would say. So diabetes is definitely related to heart disease and stroke. So when you have elevated diabetes, it definitely has a bad impact on the blood vessels and nerves. So when you are talking about, blood vessels and nerves, so high blood glucose levels can damage the blood vessels and nerves that control the heart over time. And diabetes is often accompanied by other conditions that increases the risk of heart disease. So you might be thinking of what are the other diseases. It is the high blood pressure, LDL, bad cholesterol, and low LDL. High LDL is your bad cholesterol, and low LDL is your good cholesterol, and high triglycerides. So another factor is atherosclerosis. So it is strongly diabetes is related to atherosclerosis. So what do we mean by that? It is nothing but the hardening of the arteries where plaque gets built up slowly and restricts the blood flow to the heart. Then the other factor is the heart failure. So when the diabetic level goes really, unmanageable, there is a risk factor of developing a heart failure. So there comes a time when the heart loses its efficiency to pump blood effectively, leading to heart failure. So now you all might be wondering, okay, Shri, we all know diabetes is a major factor, it's related to heart disease. So how do we go about protecting our heart? That's a good question. So how do we protect your heart? You have to go to your physician, whoever is your healthcare provider, your cardiologist, and also your diabetologist, and have a sync. And then you have to initially control your blood glucose levels, either by tablets or they'll be giving you either medications or insulin, depending upon the severity of your blood sugar levels. But honestly speaking, with your diet and exercise, diabetes would run off. You would say, Shri, you know what? I can easily manage diabetes. Yeah. So another risk factor is you have to have a diet chart. Dietitians, we might be ignoring them, but I think they play a very major role in everybody's life. And they have to be a proper dietitian, not that somebody just came up, and they have to know like what to do for which ailment, what to give, what kind of diet chart is required. you know Always stick up with a easily balanced healthy diet, and exercise at least for 150 minutes per week. But again, I would say don't go blindly by this. It depends upon the kind of surgery one has had, or the physiology, or the physiological conditions one is having before they jump onto exercises. And the major problem for all this, the root cause, I would say, is stress. Because of stress, 98% of population, it can be a work stress, it can be a personal stress, it can be bills piling up. Change what you can and leave what you can't. Sometimes in life, that is how we need to adopt. We can change what we can, and we have to leave what we can't. It's not always possible to take up everything on the top of the head and say, I want to do this, I want to do that. No. And in a day, we have 24 hours. Devote at least 1 hour, to yourself, saying that I'm going to relax, I'm not going to think anything, I'm going to do something that's going to relieve me of my stress. Close your eyes, sit. I like lights on all the time. Look, some people like to switch off the light and sleep. I'm kind of different. Like, I like everything bright and glowing and kind of nice. Even if it is midnight, I just want lamps to be glowing. Maybe they are color lamps, maybe they are bright lamps, but I don't like darkness, pitch dark. I don't entertain that. So do whatever place you like, just go. It might be a park, it might be a theater. You don't necessarily have to see movies at home. You can go to theater, you can watch movies. I had a very good friend, her name was Jazz. Like every other week, we used to go to movies together while I was doing my med. We were together, like she was my very close, good friend. And we used to go to movie together. And then we used to go to dining together once a week. We used to make sure we would dine at our favorite restaurant, and we'll go to movie, some favorite movie. It might be sounding silly, but sometimes both of us would be just watching kiddish movies, just entertaining comedy shows that would make us laugh all the time. So try to relax yourself, and the most important thing is getting enough sleep. Sleep is life. Like, people ignore it. They think, okay, you know what? Why not just 6 hours is enough? 4 hours is. It's a human body, just like a car needs a fuel, and we give the car for servicing every, say, like how much miles it's gone, how much of miles it's gone, like 25 miles, 30 miles, or 100 miles. It depends. So like that, our body also needs nutrients, protein drinks, nutrients. There is bee protein available in the market, and bees are gods. B1, B2, B3, B4, B5, B6. Bees are gods. Honestly, trust my words, if the bees are balanced, you will feel brisk. Mind will work so well. And another factor is, if you are diabetic, you can buy D protein. You get this all in the market. Have some protein drink. Protein is very essential for the body. And then have good sleep, maintain a healthy weight, healthy diet, and you don't have to eat all the fatty, saturated. At restaurants, they decorate it so well. There was a time when I used to be crazy for restaurants, but nowadays I really prefer homemade salads. I go for good curd. Curd I love, I like curd, homemade salads, fruit salads with veggie salads. And also, like, if you're using the salad dressing, you have to count on the carbohydrates. Like if you're taking like 1,000 lights or something, you have to be little bit taking care about the salads that you are using. And olive oil is really good, very nice. So little bit care on the diet, little bit of exercise, and diabetes will be running away from you, honest. So, and how do you recognize the symptoms of a heart attack? Like we discussed before, chest pain, tightness, pressure. Suddenly you are feeling kind of tightness, pressure on the chest pain. It can also be gas. It depends on where you are having the chest pain. Pain or discomfort in the arm, jaw, neck, back, stomach, or shortness of breath, nausea, feeling nauseated. Don't always jump onto conclusion, okay, I'm feeling nausea, maybe it's the food. No, don't jump onto conclusions. So it can also be a heart attack symptom if it is accompanied by shortness of breath, chest pain, tightness, and suddenly if you're running cold sweats, suddenly one is feeling fainting or lightheadedness, it can be a heart problem. So you have to be very careful about these symptoms, and keep a check on your diabetes, because diabetes is directly related to your heart. So don't ignore. See, personal problems will always be there. Professional pressure will always be there. These two will never, it's never ending. And you need to, that's what they call as work-life balance, So you need to balance both and lead a healthy lifestyle. Do what gives you happiness, I had a friend who once told me, stick on to, I went and met him. I was running late about an hour because my mom suddenly fell sick. She had a fall. I couldn't tell him that. But I got late and he was very nice and he waited for an hour for me to meet him. He was a CEO of a company. I went to meet him. He was very down to earth person. When I saw him, I was like, oh wow, he's so humble, so nice. He said, Vidya, just stick on to one path. Don't have multiple paths. It's not like only you can do one thing. If you like painting, you are doctor, still you can do painting. Or if you like any other hobbies you have, continue with that. Potential doesn't stop at a point. It's how much can you handle. That's what it is. That's what he meant. So, with the time constraint, I'm going to end up the video here. So, wishing you all a very happy and healthy lifestyle. If you like my video, please do put a like and stay tuned. I have upcoming videos now, same on diabetes and heart disease. Thank you. God bless.